Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weisheit, licensed clinical social worker. You know, guys, it's one of those times where we are so very glad to have great leadership in our area. One of those leaders is one of our doctors here with the Terrebonne General Health System. We welcome into the program Dr. Nathan Sutton. Dr. Sutton, welcome, and thank you for joining us.
Hi, Keith. Thanks for having me. I really appreciate it.
Absolutely. Now, I know, Dr. Sutton, you are now the medical director of hospital services and a part of Terrebonne General Health System's COVID-19 team. And that's a mouthful, but it says a whole lot about what you do and how you do it every day. So we're very thankful for you and your role.
Hey, I appreciate it. Yeah, it's a big task, but we're happy to do it.
Well, we were awfully excited a long time ago, back in 2020 in December. You were actually the first Terrebonne General employee to get the vaccination, and we were awfully hopeful way back then. Tell me what that was like and the thought process about where we thought we were heading.
Yeah, I mean, I think that feeling is hard to replicate. It was an incredible feeling. We were all so encouraged just sitting in that room with all of our colleagues. We all kind of had that camaraderie and that sense of there being a light at the end of the tunnel. So that was a much more encouraging time than where we are today.
Yeah, and right now we're seeing some real challenging situations. I know that we've had some spikes at different times, but right now we are seeing the highest spike in COVID-19, both in testing and the highest hospitalization rate. And some of those hospitalizations have been incredibly difficult.
Yeah, absolutely. So, as far as our, you alluded to our testing rate and our percent positivity, we're seeing the highest percent positivity rate since we did since the beginning. So what that means is for every person tested, the percentage of those that are positive, back in the beginning, it was fairly high. Now we're seeing the highest we've ever seen, and it's about 30% positivity rate. Just to put that into perspective, let's go back to mid-June. Mid-June, it was 4.5% positivity rate. So that's how huge the spike is and how big of a deal it is.
Yeah, that's dramatically high, and those are just the people that are actually going to get vaccinated, going to get tested. So there's a number of those people that are really just isolating like they're supposed to. So those numbers may be a little higher with regards to what people really have for COVID.
Yeah, I think they definitely could be. Just like you said, this is just what we're seeing through our facility, and those are just Terrebonne General Health System specific numbers.
Wow. And again, in other places in the parish, we're seeing some 20 or 25, and you guys are seeing some 30, which is dramatic. And so the difficulty with that is that we've got people that are going to get tested, and they're being tested in this term that we're using now, this Delta variant, that really throws a tremendous change in what we've seen in COVID to this point. And so this Delta variant is different because of its virulence. It's different because how it affects the lungs. Can we talk a little bit about what you see with just this Delta variant and maybe why we're seeing it so high in this area?
Yeah, definitely. So the Delta variant, it's just so much more infective is part of the problem. So we don't know exactly how much more infective that it is. And one thing that I stress, I know people get upset because we'll say one number and then the number changes a little bit, but that's because this is all a novel coronavirus and it's brand new. And the data comes out and the data changes. So right now, what I'm going to say is that as far as infectivity rate, we're somewhere between 40 to 80% more infectious. So that's just astronomically more infectious. The other thing that we've been seeing as far as nationally, and the research is showing that the viral particles, it's up to 1,000 times more viral particles in the respiratory tract with the Delta variant. So those are things that are definitely causing us problems.
Yeah, and just to qualify that a little bit so people understand, again, that 40 to 80% means that this infection, it allows for it to be spread so much more quickly, so much faster to more people than the previous COVID-19 issues were.
Exactly. So that's exactly what you said, and that's why we're seeing this huge spike.
And then the 1,000+ particles, I think people are seeing that term Delta variant and pneumonia together, is that because of how it's impacting people's lungs where you guys are seeing in the hospital?
Yeah, so we all think of before COVID, we all thought about pneumonia as a bacterial pneumonia. You come in, you get some antibiotics, or you take an antibiotic pill. That's, there are viral pneumonias, and what COVID causes is a viral pneumonia. So when we have people come in that are severely ill, it's a COVID pneumonia, and we're seeing drastic. The COVID chest X-rays are very characteristic. So when you pull them up on our, when we pull them up on our screens to look at them in the morning and throughout the day, it's very specific what they look like, and it's a viral pattern and an atypical pneumonia.
One of those things that people keep talking about, I know that there's a lot of resistance. There's a lot of people that don't want to get vaccinated. We certainly see it in Louisiana because we have one of the lowest rates. We see it in the parish because Terrebonne Parish is one of the lowest rates of those vaccinated. But this Delta variant creates a very difficult proposal for those people that you're seeing or that y'all are seeing in the hospital. Let's talk a little bit about this Delta variant and how bad it is, and what we're seeing maybe in that contrast between those vaccinated and those not.
Definitely. So like I was saying, as far as the Delta variant, it's 40 to 80% more infectious. So definitely spreading like wildfire around our community. As far as vaccinated versus unvaccinated, we've got a couple of good studies that both agree with the vaccine, you're 88% less likely to be hospitalized and 91% less likely to have severe illness from COVID-19, the Delta variant specifically. So I think those numbers speak for themselves. It's really impressive. As far as our numbers at Terrebonne General, these change from day to day, obviously, because we have new admits, people discharged. But for today, at this moment, when I'm speaking, we have 40 patients that are COVID positive in our hospital that we're treating for COVID. We have 8 in the ICU. Of those 40 patients, we have 4 that are vaccinated, meaning that greater than 90% of our hospitalizations are unvaccinated.
And again, the facts speak for themselves. And Dr. Sutton, I can tell you just in the field that I work in and just kind of visiting and talking to some of our neighboring parish hospitals and neighboring hospitals, they're seeing that same thing, that 90%. And those patients that are unvaccinated are the ones that we're really seeing. And some of those are really sick.
Definitely. So you can tell the difference between the vaccinated and unvaccinated patients. The few vaccinated patients that I do see, for the most part, are much better off than the unvaccinated. The unvaccinated are getting extremely ill. One of the different things that we're seeing with this Delta variant. So back, previously, I saw a couple of young people that had that had COVID-19 that were, bad enough off to be hospitalized. However, with the Delta variant, the younger population is really just getting hit hard. I have 8 people in the ICU right now, and 4 of them are somewhere between 30 years old and 48 years old, 50 years old.
And that's the thing that we're seeing, some of those statistics, and it matches over at Terrebonne General, that we're seeing that the 30 to 50-year-old range is a high percentage of people that have not been vaccinated, and those are the people who are the most sickly right now. Some of the others have reported that those that even have to be hospitalized that are vaccinated have a much easier hospital course. Would you agree with that as well?
Absolutely. My vaccinated people that do have to come in, which I've alluded to, are few and far between. They're doing much better. They're doing much better overall. We're seeing a quicker recovery. Time out of the hospital is much faster. And just to reiterate with that age group that you mentioned, those are the people that we think about. I think about myself in that age group. I'm well. I'm not going to get sick. All those things, we're healthy. That's not the case anymore. And we can't really think that with this Delta variant because we're seeing it. And unfortunately, I look into those people's eyes and I see it, and I ask them if they got the vaccine, and it's immediate regret. It's immediate regret that we're seeing.
Yeah, and so I guess based on that information, based on those numbers, and thank you for representing that, because quite frankly, it's just one of those things that I don't think we can define when you look into somebody's eyes and you ask that question. And we're not wanting people to regret. We got about a minute left here. I guess the one thing is, what we want to say to people who are saying that their risk of getting COVID is kind of decreased from the risk of them getting the vaccination, and those that don't want to do it.
Sure. So, yeah, I really don't understand that. I don't understand where it's coming from because the data just doesn't support that. The vaccine is safe and it's effective. And some people think, well, I'm just not going to get COVID. I'm not going to get COVID, so why would I get the vaccine? That's not true. In my opinion, you're going to get one, so we just need to pick which one we're going to get. And the vaccine is just such a better option than getting COVID.
Yeah, and it's either of those three vaccinations that people can get. I mean, if they want to do some of the research and they want to spend their time really spending some energy about what they should or shouldn't do, it should be maybe which of the vaccinations to get, not which one of these, because quite frankly, what you're telling us is that this, as it spreads, 40 to 80% more virulent than the others, there's a much higher chance that more people are going to get that.
Absolutely. There's a much, much higher chance that they're going to get it. And that's the strain that we're talking about today. If we don't increase that vaccination rate, what strain are we going to have tomorrow? And how much more virulent is it going to be than the Delta variant?
We know that you really oversee all of those patients there in the hospital and what's happening. And we appreciate all the statistics that you shared with us. I guess my big question is, we've been hearing about what has been happening with this Delta variant, the volume of hospitalizations, especially with this younger population. Can we talk about how it's been impacting you and your team over at Terrebonne General?
Absolutely. Our census has increased significantly. We're having some bed shortages. We're having patients that are boarding in the ER. So overall, it's putting a big burden on the healthcare system right now.
And so I know that we've had a bit of a nursing shortage. We know that we've had some challenges in that area clinically. Can we talk a little bit about how and what it takes to take care of one of these patients, either on the floor, and then how much more intensive that is when they're down in the unit?
Yeah, so it takes a ton of resources. So right now on the floor, we have one nurse to 4 COVID patients, and in the ICU, it's even more stringent. We have one nurse to 2 COVID patients at best, and sometimes we have to have 1-to-1 if that's available. Those are the numbers that we like to have. As these numbers continue to boom, we're not able to provide that. So our nursing staff is stretched thin. We're all stretched thin. Our resources are stretched thin. So as this variant impacts our area and our hospital, right now, or as our hospital starts to become overwhelmed, it's going to be a problem.
Well, and one of the words we never like to use is divert. I mean, diverting people is not good, but we're running the risk right now, like you mentioned, with the number of people that are having to kind of wait in the emergency room to get a bed, some of those people that are having to transition with the volume of COVID patients that we're seeing. We're not only stretching the hospital staff then, but we may be stretching to the point that we can't take in some of those people that need the quality medical care that they get there with other illnesses because of COVID.
Absolutely. We certainly run that risk of just the run-of-the-mill things that we see on a daily basis pre-COVID. If COVID keeps hitting our community as hard as it is right now, and that continues, we certainly run the risk of not being able to provide care for those patients. There's the routine medical things, and just that word that you use, diversion, is certainly a possibility in the future if this continues. That's, obviously very discouraging because we want to provide care to every patient in our community. But the problem with that is, where do they go? Because if we're getting that hit that hard, then the rest of the hospitals in the community are too. So then we start having problems getting people to other places because there's no beds anywhere. And then other tertiary facilities in our community that need a higher level of care that we're able to provide here at Terrebonne General, they can't get their patients here anymore because we don't have any beds available.
And so if the community is asking the question, what can I do? We're going to put the flyer up because Terrebonne General has made it nice and easy for people to just go and get their vaccination. It's been very obvious that all of the statistics have shown that getting your vaccination is the much lower risk and choice than getting COVID. So we want to make sure that people know how they can go about and access that wonderful system. We have a drive-through system there at Terrebonne General. And so we want to put that flyer up for people to be able to see and be able to let them know what they can do to go about getting access to that vaccination.
Yeah, definitely. And the two things you can do, the biggest one is on the screen right now, get vaccinated. And the second thing is please wear your mask. The mask mandate was put in place for a reason. After the mask mandate was lifted, we've seen this huge surge. We know the mask worked. It's effective. We need to just do our part, wear our mask, get vaccinated. And just as you alluded to, Keith, we offer the vaccine here at Terrebonne General. We've got a drive-through. You don't have to get out of your car. It's by appointment only. You can call 873-HOMA. It's right off of Main Street near the Mary Bird Perkins Cancer Center. So please give us a call. And we also have an event this Saturday, which is August 7th, that we're offering vaccines.
And so we really appreciate the option. And Terrebonne General has taken part. They've stepped up and said, you know what, we want to make it easier for the community. We're a community-based hospital that's truly wanting to make a difference and making it easier for people. And so it's right there. It's accessible. You can get in there right there off of Main and Liberty. It's there at the corner right by the hospital, as you mentioned. But more importantly, they're going to make it easy for you to do that. Or you can go to MyChart. And so you can sign up either the phone number that you listed, or they can go to MyChart and they can make that request as well. And that's tghealthsystem.com/MyChart. And you can schedule your appointment there. Again, safe, effective, and free. And if you've listened to anything that Dr. Sutton has said over these last few segments here on Bayou Time, he's let us know the importance of being able to go and just get your vaccination and do that. We got about 30 seconds left. Doc, is there anything you want to share with the community as we wrap up here?
Yeah, absolutely. Just with any vaccine, it's not 100% effective. Can you still catch COVID with the vaccine? Certainly. But just remember those numbers that I told you about. 88% less chance of being hospitalized, 91% less chance of getting severely ill. The vaccine is readily available. It's safe and it's effective, and it's the way that we beat this. So mask up, get vaccinated, help your community out.
And so, Dr. Sutton, we want people to be able to see you on HTV and not have to go and see you in the hospital. But we're really thankful that you're there, and we always appreciate your time. Thank you so much for joining us.
Thanks for having me, guys. I really appreciate it.
Yes, sir. All right. Again, that's Dr. Nathan Sutton, the medical director of hospital medicine over at Terrebonne General Health System. All right. We're going to take another short break. Don't go anywhere. A lot more Bayou Time when we continue.